Do you know that adequate sleep is crucial for maintaining your overall health? And understanding the importance of sleep and maintaining good sleep pattern can help promote your good health and well-being. What then is sleep? Sleep can be defined as a natural and periodic state of rest for the mind and body, which is essential for overall health and well-being. The functions of sleep and its importance cannot be overemphasized. When we sleep, our tissues and muscles are repaired. They are regenerated. They are repaired. Our immune system are strengthened when we sleep. Sleep improves our memory and learning processes. It also promotes sleep and emotional regulation. It regulates our mood and stress levels. It equally regulates the hormones that controls appetite and metabolism. Hello, welcome to my YouTube channel. This is Nurse Faith Health Hub, where everything that concerns health is being discussed. If you're new to this channel, my name is Nurse Faith, a registered nurse, a registered midwife, and a Bachelor of Nursing Science degree holder, currently practicing in Nigeria. If you have not subscribed to my YouTube channel, please do not forget to click on the subscription button and notification bell. And those that have subscribed, I say thank you very much. And so today, we are going to be discussing about a very interesting topic, which is very essential to our health and overall well-being. That is insomnia. What is insomnia? Insomnia simply means loss of sleep, inability to sleep. Some authorities describe insomnia as a common sleep disorder, which is characterized by difficulty in falling asleep, staying asleep, waking up too early, and being unable to go back to sleep. So when you look at this definition, you find out that the insomnia simply means that individual finds it difficult to sleep off. Even if the person is able to sleep off, the person finds it difficult as well to maintain the sleep. He sleeps this minute, the next minute he or she has already waken up. Waking up too early, waking up several times in the night, and unable to go back to sleep again. Insomnia can be of short-term or long-term duration. When it's of short-term duration, we call it acute insomnia. When it's of long-term duration, we call it chronic insomnia. How do you differentiate between acute and chronic insomnia? Acute insomnia lasts from one night to few weeks. Maybe it's as a result of stress from work, loss of job or loss of a loved one, noise in the environment or lights, and it can resolve on its own. Or when somebody travels out of the normal environment and goes to a place, maybe the environment is not comfortable, the person may, because of the period he or she is staying there, cannot have adequate sleep. That one is a transient or acute or short-term insomnia. But when the insomnia happens for up to 3 times in a week, lasting for up to 3 months or more, we call it chronic insomnia. The thing that causes insomnia in this situation doesn't go away. If it is a stress, the stress is persistent, it continues, it doesn't fade off. And because of that, the insomnia lingers for a very long time. Studies have shown us that 30 to 35% of adults experience acute insomnia, while 10 to 15% of adults experience chronic insomnia. And women are more prone to insomnia more than male. Why? Because of hormonal changes. For example, pregnancy, menstrual periods, and menopause. All these hormonal changes and cycles can alter the sleeping pattern of a woman, unlike men that doesn't pass through all these stages of pregnancy and menstruation. What can cause insomnia? There are several things that can cause insomnia, ranging from stress from work, stress from school, financial pressure, some life events that can keep the mind active all through the night. All these things that cause stress, which can prevent an individual from getting adequate sleep in the night. Anxiety, worrying about what to eat, worrying about what to wear, worrying about house rent, and a lot of things, a lot of situations can take away sleep from somebody, which can be acute or chronic and continuous. Depression. When an individual encounters things that weighs him or her emotion down, that's a depression. The person may not be able to sleep very well, or from there may not sleep at all. All these things can cause insomnia. Substance abuse, taking alcohol, nicotine, caffeine, and other drugs that can stimulate your body systems. They can cause insomnia. Loss of sleep. Another thing that can cause insomnia is pain. When someone is experiencing any type of pain, it can lead to person to lose interest in sleep. Also, some drugs can also take sleep off somebody, can alter the body system. BP, some of the high blood pressure drugs, some of antidepressants, they can alter the body systems. Some of the over-the-counter drugs can also do that. Noise and light in the environment. Excessive noise, exposure to light during night, it can alter sleep patterns and also cause insomnia. Uncomfortable sleep environments can as well predispose somebody to insomnia. For example, if an individual has a poor mattress that is not comfortable to sleep on, uncomfortable pillows, overcrowded room, all this can lead somebody to not to have enough sleep in the night. There are some certain signs that somebody may manifest. You now know that this person is suffering from insomnia. We call it signs and symptoms. And in this case of insomnia, we have night symptoms, we have daytime symptoms. In nighttime symptoms, the person finds it difficult to fall asleep. Despite that individual is very, very tired, he or she finds it difficult to sleep off. Another nighttime symptom is waking up several or multiple times during the night. The person can wake up to 5, 6, 7, or 8 times in the night. Another sign you can see in the nighttime is waking up too early or earlier than desired. And when the person wakes up early, he or she cannot go back to sleep. That's an insomnia. And also, a feeling of that individual has not slept well. You have slept throughout the night, but when you wake up in the morning, the person will still be feeling that he or she has not slept. That's a sign of insomnia. So when we come to daytime symptoms, we find out that somebody that is experiencing insomnia during the day is always tired, always feeling weak, always feeling tired. You cannot say, let's go to this place. You say, let us go. He will not tell you that, please, I'm very, very tired. Oh, I'm very tired. Always feeling dizzy, always feeling weak. It's a sign of insomnia. It's a sign that the individual did not receive enough sleep during the night. Also, another daytime symptom is mood swings. When you see a lot of people having mood swings, feeling of depression and anxiety, please don't judge them. It may be a sign of insomnia. They may be encountering challenges in the night. They may be encountering not sleeping, and even if they're sleeping, they're not sleeping properly. It's a sign of insomnia. Also, you'll see that the person is finding it difficult to focus and pay attention and to remember things. Tell him or her this, next minute ask, you say, what did you say? I've forgotten, I can't remember anything. It's not their fault. Brain is not stable. The body system is disorganized because of insomnia. They also encounter reduced productivity and performance at work or school. They cannot produce, they cannot perform. If the person is a student, the person will be doing very poor in academics. If it's someone that is doing work, that is working in the office or place of work, the person cannot produce anything. Even if you pressurize the individual to do whatever you mandated him to do, he will go ahead to make mistakes. And there are increased risks of accidents because of impaired alertness. Also, they experience frequent headaches all the time. Headache. Check out. Are you sleeping well in the night? If you're sleeping well in the night, how quality is your sleep? What are the complications of insomnia? When I mean complications, I mean the dangers of somebody not getting enough sleep, the after effects. What can insomnia result to? It can lead to development of hypertension, heart diseases, heart failure, and even stroke. The person can develop type 2 diabetes mellitus, unnecessary weight gain, because the body metabolism is not functioning well, obesity. Okay, the immune system can become low because of that. Infection and illnesses can set in. The person will encounter depression, problems with memory, attention deficit. The person cannot be paying attention. Decision making is zero. Come on, let us decide. Let us have a meeting and decide way forward. The person is not there. The person will encounter reduced ability to concentrate and perform any task given to him or her. The quality of life of such a person is reduced. Mood swings that can lead to issues with people and loved ones, and also leading to loss of relationships. Increased risk of accidents, motor accidents, office accidents, hazard accidents, and a lot more, due to reduced alertness. It can lead to substance abuse because the person is not getting enough sleep. You know, say, let me be taking anything I see to know if I can go back to bed. And because of that, person can now develop drug dependency, impaired cognitive function. That's another one. Person cannot, the brain can no longer process anything. The cognitive function is impaired. So how do we manage? How do we tackle? How do we treat lack of sleep? How do we take care of somebody that is encountering or suffering from insomnia? First of all, make sure that the person is encountering regular sleep schedule by going to bed and waking up at the same time every day. Plan your sleeping pattern. Go to bed, let us assume you want to be going to bed by 8 p.m. every night. Make sure that by 8 p.m. you're in your bed and wake up at the appropriate time when you have already scheduled. Tomorrow, the same way. Not when you now sleep by 8 p.m. today. Tomorrow, you are pressing your phone, or you are watching television, or you are having discussion with another person and become distracted with so many other things that are irrelevant to you. Please, even if you be distracted, make sure that is relevant, and after you maintain your sleeping schedule. Very important in this treatment. Then another important point here that will encourage you, if you are encountering insomnia, to be able to maintain your sleeping pattern is you create a comfortable sleeping environment. Keep your bedroom cool, dark, and quiet at night, so you'll be able to sleep off. Avoid caffeine, nicotine, and alcohol towards the time when you're going to bed. Even if you take them ahead of time. Take them maybe 2 or 3 hours before bedtime. Then please limit exposure to screens. Phones, tablets, laptops, and computers at least 1 hour before bed to avoid stimulating your nerves. Use the bed only for sleep or sex. Don't use your bed for work or other activities, so that when you come to bed, you know that you're coming to sleep. It's not when you come to bed and now find out that you have not finished this particular work. You have not finished taking care of this particular assignment. You will now move and start doing that. From there, your sleep will go off your eyes and your sleeping pattern will be disrupted. Engage in a regular exercise. Please, very important. But don't engage in stressful exercise towards the bedtime. Another important point here is avoid heavy and large meals close to bedtime. Even if you're going to take anything, take light diet or snacks. An adult supposed to take a meal 3 hours before night bed rest. Very important. Please and please, when you must have done all this I've said here and you find out that you still cannot sleep, what do? Do go and meet your doctor. Very important. So that you'll be examined. If a test should be run on you, it will be done. And you do what? Get your sleep back. So that you function properly. Remember that sleep is very important to our being here, to our proper functioning in every part of our health. Sleep is very important. Without sleep, every other sickness and disease and the body system will be disorganized. So if you have done all this and you find out that still you cannot sleep, go and consult your doctor. And also, if there's a medication or anything that your doctor has given to you, and you find out since you'll be taking that medication, you haven't been getting enough sleep, please go back to your doctor to complain. So with this, we have come to the end of today's video. If you enjoyed this video, please do well to give this video a huge thumbs up. Subscribe to my channel, leave a comment in the comment section, and I'll be there to respond. If you have any question, turn on your notification bell because I have more informative and educative videos coming your way on this channel. This is it for now. Stay tuned and see you in my next video. Thank you very much.